looking for care?
Just establishing a hospital and making it profitable, and a college and making it profitable is a smaller aim. So if you aimed at something that you can achieve in your own lifetime, that is called a smaller aim. Our aim should never be small.
CARE has the first team that conducted an angioplasty in India. First team to develop the coronary stent, Kalam Raju, in Asia. One of the first teams to perform the cardiac MRI in the country. It has pioneering surgical treatment of difficult to treat epilepsy in this part of the world. One of the few to have robotics in surgery. One of the first to treat rhythmic disorder. Treatment for holes in the heart. First hospital to launch telemedicine services linking district hospitals. And yes, we are also the first to put patient interest above our own.
Myself and my colleagues, whoever is in CARE now, we started at different places, but most of us came together at Nizam's Institute. Many of us were in search of a platform where medicine can be practiced at its best. Medicine required patient-centeredness, patient care. We need to have medical education. We need to have research. So, to make all this possible, we need a right platform.
That is the vision we started with, and that is the mission we continue to pursue with passion. CARE offers highest quality healthcare at lowest cost, accessible to all, practicing medicine as it should be.
I'm on Raju Kalam stent, and this is excellent. I have no problem about it. I undergone very recently, about a few months back, an angiogram done after 1997, and I did my angiogram done in 2012, and I found everything is alright.
Quality we look at in two dimensions. I mean, what the patient experiences and what we give in a medical quality. When I say medical quality, are we giving a safe medical care? Because that is the first dictum of medicine, do no harm. So are our services safe? The second is, what is the outcomes? If somebody comes with a heart attack, somebody is coming for a bypass surgery, somebody coming for a gallbladder surgery, what are the clinical outcomes? I mean, that is the most objective measure of quality. Now, that is a benchmark internationally, are you there or not there? Because this patient will not appreciate the medical outcomes. Patient will not accept. What he appreciates is only the experience he and his family has from entry to exit.
what took off as a 100-bedded single-specialty heart institute facility focusing on cardiac care in Nampalli, Hyderabad, today is a group of multi-specialty hospital chain comprising of over 1,800 beds in hospitals across India, expanding footprints abroad.
I listen in my country, care good. Kid address my friend. I come Hyderabad, come hospital. This hospital good, very good.
Including my son, it will be total 3 generations visiting to Care Hospital. Saved my life once, saved my parents' life twice. It is absolutely undescribable.
This person was suffering with severe eczema, unable to find a solution, and the person visited countries like Germany and Singapore. Even there, she was not able to get the appropriate treatment, because the treatment done was most to suppress, not to eliminate the problem. Then finally, I came to know. Then I suggested this person, why don't you come to Care and let them analyze. Then I was myself surprised, because Care is broadly known as a treatment for cardiac patients, and this was a severe case of skin ailment. So it was more to do with the way the doctors analyzed, and probably for the first time in the world, this treatment was done. And I'm sure this is something which has to be a case study for any hospital.
All this was possible due to a coordinated team approach and intense research-based culture right from inception. Most of our key doctors hail from academic institutions. This credible blend of academic and professional excellence, teamwork and coordinated approach enables us to have an in-house cardiologist 24/7.
As an interventional cardiologist, I have personally worked with different sorts of setups, a trust hospital, a private corporate setup, and for the last 4 years I am with the Care Heart Institute, Surat. And the difference is clear that the Care Hospital group as such is owned by doctors, and therefore they have got the perspective of the doctors as well as the patients in mind when running the hospital, and that makes the difference.
The core team, which came together 25 years ago, have remained together to this day. Depth of excellence can be achieved only when they work as a team.
I was the first resident doctor of this hospital when I just finished MBBS and just joined MD. There were no patients at that time. This was a new center then, and we used to be night duty doctors here. It's from then which I got fascinated with Care, the ethics of people, seniors, the way they drove the whole thing, their zeal for getting the patient right. The whole concept of patient is the most important thing that actually brings us to the center point of all this. The whole thing of working as a team. It's not like it's my patient, so only I see him and nobody else sees him. The thing of cross references, that in case I think that is an opinion of somebody else that's required, we call them. They are by no malice and nothing, they come see the patient, we discuss things. It's done in the best interest of the patient.
Our vision to evolve as a unique academic medical center-based healthcare center has borne results. We have succeeded in inculcating a culture of continuous knowledge sharing, education and learning. This sparks off intellectual challenge among professionals and helps retain the best talent. An incomparable culture exclusive to Care. Technological advancements aside, we continue to be a leader in the industry for personal approach we take with every patient.
when you say care, it takes care and takes care of you very well. I've had a number of occasions to go there. The latest was about 6 months ago when I had my femur had fractured, and general care was very good, and particularly the nurses there, I found, doctors of course are very good. I wanted to write to the chairman that these nurses have been very good, extra care.
We nurture a new generation of professionals with lifelong commitment, dedication, knowledge, skills, wisdom, and values.
We don't run behind numbers. What is important is the quality of service which we provide and how good that person has been and how good his contribution has been to the overall growth of the institute. Nobody cares how many cases you have done or how many angioplasties you have done, how many stents you have put. If you have probably refused to put stents in a patient who didn't require it, nobody questions. But if you have put an unnecessary stent, then definitely there is somebody else who questions it. So that's something great which probably hardly happens in any other institute, not only in this country but probably throughout the world. The professional freedom, the academic atmosphere, the ability to mingle with others, the work atmosphere, the comfort which is given here, it is extraordinary. There is no way that any other place can come even close to this.
To check gaps, if any, we have the ethics committee that conducts the mortality meetings to find reasons for a patient's death. A unique feature at CARE. CARE is striving for public trust and maintains medicine's humane and noble place among professions.
Somewhere something speaks of the special service or attention to detail care has been given and how they approach. I could get the feel of how seriously they were trying to find the solution to the problem.
In a world racing for super specialities, we lay strong foundations to serve humanity with core values, to make healthcare affordable to all. CARE is taking a doctor to every village doorstep, providing urban healthcare in the remotest rural villages. Strong in ethics, CARE has reached the unreached, touching over 400 villages and 18 lakh population in Andhra Pradesh, Maharashtra and Odisha.
Anyone who does this with humility, courage and wisdom. And Harrison goes on to say, a physician means a doctor or healthcare professional today should ask of his destiny no more than this and should not be satisfied with anything less than this. So that is, those are the words which inspired us actually. And then many of my colleagues believe in it.
It is spearheading globally competitive healthcare services and related businesses, maintaining strong ethics, affordability, accessibility, sustainability, scalability, and cost-effectiveness to all. Therefore, there is CARE in every hospital now.